Here tonight at the Pasadena Westin Hotel for Grey's Anatomy private viewing party in support of Cure Mito, which raises awareness for mitochondrial dysfunction and cyclic vomiting syndrome. I'm Julie Lynn here with Chandra Wilson, better known to you as Dr. Miranda Bailey of Grey's Anatomy.
Mitochondrial disease, right, and manifesting with cyclic vomiting syndrome and abdominal migraines. A lot of times manifestations do come in, 2 or 3 or 4 different areas of the body. It's not just one thing. And so these are her 2.
And so those are the only 2 that she has
so far. So far, but they can change. Abdominal migraines can become migraine headaches, and cyclic vomiting can become, chronic fatigue. So it just depends on, where the energy supply gets depleted.
Now, your daughter was diagnosed at age 17.
At 16.
Yes, 16. And I understand that it is very common for this to be diagnosed between age 4 and 7.
Sure, yeah. It depends on when the manifestations start to show up and how they manifest. It's different with everyone. My daughter showed up with cyclic vomiting syndrome that initially was mistaken for food poisoning, initially mistaken for, some kind of blockage in the intestines or stress-related, something she may have been doing to herself.
Right.
All of, the gamut of all of that had to get ruled out first.
You've become very involved with Cure Mito.
Yes.
And you are the spokesperson for CVSA.
Right.
And is your daughter, I know she's in college and she's very busy, but is she involved with either of the organizations?
Well, when she was going through one of her last really, really violent bouts of cyclic vomiting syndrome, it was at that time where her esteem and her optimism about graduating high school, going to college, all of that started to kind of fall into the toilet. And I said, you know what, you're not the only one going through what you're going through. I got to prove that to you somehow. If you give me permission to kind of start speaking out on what you're going through, even if there's one other person that you're able to identify with, I need you to see that there's another person in your same predicament. And then that's when my relationship with the Cyclic Vomiting Syndrome Association began. And since I was a patient with Dr. and we started his regimen of treatment, and she entered remission for the first time in almost a year. It really became for us about continuing the work that's being done with Cure Mito, because she saw the difference in her life and definitely wanted somebody else to see that. So she kind of trusted me to do all the speaking while she, figures out how to keep her illness managed.
I see. So she's been on board with you going very public about her situation, and you did that really to help your own daughter so that she wouldn't feel alone in the process.
Yeah, because it's really about that esteem. When you have something as debilitating as these manifestations of mitochondrial dysfunction, your outlook on your future, it starts to change. And I just didn't want that to happen.
Well, to bring this to Grey's Anatomy, your very personal experience, how did you go about doing that?
Well, I made a pitch based on Selena's episodes, what she was going through. I wanted to make sure that it incorporated an adult character, because adults are some of the, kids have their parents and pediatricians there to kind of advocate for them. But adults, by the time they get to the emergency room, they're coming in because they've been sick for a while. Not because they just got sick yesterday. They've been sick for a while, can't manage it anymore at home, and need to come into the emergency room. At that point, you can't really talk for yourself. You can't really advocate for yourself because somebody's with you. And a lot of times, ER doctors don't really know what to do. They haven't identified what's going on with you yet. So I really wanted to make sure that we saw it from an adult point of view. Keeping in mind that what you're going to see on this episode is it's, series television, it's a dramatic series, and we concentrate on the series regular show. Isn't going to be as violent of an episode of cyclic vomiting as as CBS usually experience, but if I could get that name out there nationally, if I could get that public service announcement at the end, and I can make the phone ring somehow with somebody being curious about what they saw, and that drives them to the message board, or that drives them to Facebook, or drives them to Twitter, and they see themselves on those pages, then, you know, that's more than what we had yesterday. You know?
Right. So do you feel that the episode that we're about to watch tonight, are you satisfied with it? Do you feel like it touches enough and shows what CBS and mitochondrial?
I feel like it gives a little bit of behavior. It presents a gentleman who, you know, he serves as kind of a device for the show, for the doctors to be able to deal with. But the predicament that he's in as a grown-up is something that, you know, a lot of sufferers, they can't home, they end up not being able to have jobs, they end up estranged from their families because they can't really explain what's going on, estranged from friends because they're sick all the time, and are on the verge of giving up, or have given up a lot, and just resigned to the fact that they're sick and don't really understand why. This is the predicament that we will find in the character. So, like I said, even though we don't run a full gamut of what a CBS episode, particularly, like I said, my daughter just came out 2 weeks. I can't keep you 2 weeks on 42 minutes of Grey's.
Obviously, unfortunate that this has afflicted your daughter, but it's wonderful that you are in this public eye and that you are on this hit show and you are watched by so many and that you have the heart to try to touch others, and you're going to do that tonight, and so we're all very grateful for that.
I made a pitch to my writers earlier in the summer about a two-part arc storyline where I could really go into the depths of what cyclic vomiting syndrome and abdominal migraines were. And the episode that we're going to see is kind of what they came back with, which wasn't exactly what I pitched. And so in weighing the pros and the cons of it, the ability to be able to say cyclic vomiting syndrome on national television with an audience of, you know, 10, 11, 12 million people, and to be able to do a public service announcement at the end of that episode meant that even though somebody might be mad about what they see, somebody's still going to make a call. Somebody's still going to go to Facebook and they're going to see somebody else that was mad because they're going through, you know, they just got out of the hospital. Or, you know, my daughter Serena, she just relapsed after 2 years of being episode free. And so here's this 19-year-old that was going all about her life, thinking everything is good, and then all of a sudden the realities of what how she has to take care of her body was there for her in full effect. So she just got out of CHLA after being there 11 days. I think that was the longest bout that she's had. But so basically what you're going to see isn't going to be the most violent of episodes of cyclic vomiting syndrome, but again, that name, when we got a name, a definitive name, it changed everything for us. When, oh goodness, when Linda Cowan was completing my sentences for me as I was talking to her about what my daughter was going through, just the relief in that, and you know, Dr. Bowe's giving clarity and something that I can like put my finger on, it changed everything for us. So anyway, sorry, who are you? What do you want?
Over half the patients with cyclic vomiting syndrome also suffer from clinical depression.
Even at that very young age, at preschool.
It's hard to recognize depression prior to puberty, but a lot of them still have clinical depression. And why, for people thought that was because they were vomiting all the time, who wouldn't be depressed. But I noticed that in the family members had a tremendous amount of depression as well, even family members that didn't live with the patient. So if you look at the mother's sister has the same mitochondrial DNA sequence because it comes from the mother. A mother will bring her mitochondrial DNA sequence to all of her children, regardless of the gender. So the grandmother's mitochondrial DNA went to all of her children. So she has 2 daughters. One of them has a child. All 3 of those will have the same mitochondrial sequence. So the maternal aunt has the same mitochondrial sequence, but it's not the illness per se, it's the mitochondrial sequence that predisposes not only towards cyclic vomiting syndrome, but also depression, irritable bowel, gastroesophageal reflux, as well as other chronic pain disorders and chronic fatigue syndrome. So they're all tied in together, and we see, when you look at the family and you look at these very large pedigrees, and there's a lot of maternal relatives that all have the same sequence. One will have irritable bowel and chronic fatigue, another one will have depression and reflux. That there'll be different manifestations of what we call functional disease in different relatives. And you need to treat the whole patient. Unfortunately, the way that our medical system is balkanized today is that you go to the psychiatrist for depression, you go to the neurologist for migraine, you go to the rheumatologist for leg pain, you go to the cardiologist for tachycardia, and I can go on and on and on like this. Some of these patients have been to 7, 10 different subspecialists for diseases which are all really the same, just different parts of the body showing abnormality of the autonomic nervous system. And the treatment for all of these conditions is not coincidentally the same, because it's treatment that works on the mitochondria and on the autonomic nervous system that is affected by the mitochondria. So treatment is complicated, but to give you just a general idea, one of the first things that we do is we tell the patient what's going on, just understanding what the problem is and that they're not crazy and that it's real. They didn't make up the disease, and that they're going to get better from it with treatment, that it's not going to kill them often makes a big difference right there. Anxiety goes down. When anxiety goes down, energy demand from the brain goes down. The energy that's being made by their cells is only so much, so energy demand goes down, that's good. We try to tell them other things like to not run on a hot day or something, because when is your electric bill the highest? When is your electric bill the highest? It's when it's a hot day or it's a cold day, because changing temperature requires a lot of energy. It's the same for the body. When it's a cold day or a hot day, that increases energy demand. They don't have the supply. So things like that, avoiding certain things that have high energy demand, fasting, too much emotional excitement, not eating right, alcohol, things like this that increase energy demand on the cells are things to be avoided. Plus, we tell them about diet, high-protein diet, low-fat diet, more fresh fruits and vegetables, which are antioxidants, kind of clean up what the mitochondria are making, the mess they're making. The diet sometimes, in and of itself, gets rid of the episodes.
Really?
Uh-huh.
So you do see that?
Diet and exercise are very important parts of therapy. In most patients, they don't do everything, but they help. So diet is important, exercise is important. If you're an athlete and you want to do better, you want more mitochondria, so you exercise more. Okay, couch potatoes have less mitochondria, athletes have more. The more mitochondria you have, the better. So exercise is a very important part of therapy because it builds more mitochondria. More of them is better than less of them, even if each individual one's not working as much as someone else's. Then we use what we call nutraceuticals. They are vitamins, but they're not just vitamins that you would just go over the counter and just get a multivitamin. They are special vitamins that are given at amounts that are 1,000, 10,000 times what's in a multivitamin.
And so are those given as shots?
They can be, but generally they're given orally. One of the ones is coenzyme Q10. A decade ago it was hard to find it at all. Now you can find it everywhere because it's used in a very large number of conditions. From migraine to post-cardiac surgery, just older people in general to give more energy. Coenzyme Q10 is not only an antioxidant, but it also helps energy go through the pathway by pushing the energy pathways. So regardless if you're a normal person, don't have any mitochondrial problems, or if you have severe mitochondrial disease, you'll have more energy on CoQ. So not only do the families often take it, but the mitochondrial doctors do too.
Yeah, that sounds great. Okay. Now, how is that different from a B12 shot?
Sometimes some of the patients are on B12 shots, but I usually recommend a B complex. The B12 is important. It's in a B complex. B2, which is riboflavin, also pushes energy pathways. B1, B3, B6, B9, all of these push energy pathways. A B complex will have all of these in it, and that's one of the things that we do.
So how is the B complex different from the CoQ10?
It's just a different vitamins.
Okay.
So the vitamins and what we call the lifestyle changes, avoidance of certain things that have high energy, eating frequently, eating right, exercise. Also, one thing we didn't talk about is sleep hygiene, going to sleep approximately the same time every day and getting the a good amount of sleep. These things are all important, but in about half the patients, we need to use medications on top of it. So the medications we use have been used for decades for treatment of functional disorders. Sometimes they're called antidepressants because they started off being used for depression.
Right.
But today they're used for everything from irritable bowel to chronic fatigue to chronic pain, migraine, you have it, any functional condition. Amitriptyline is probably the one that I use the most often. You can call it an antidepressant or an dysautonomia that works on the autonomic nervous system. But amitriptyline also works directly on the mitochondria.
So would you start with the vitamins, and then if those don't work, then you move to the antidepressants?
That's like trying to explain 10 years of experience in a sentence. To try to put it
in layman's terms.
Okay, I would lose all of my, no one would have to come to see me. But anyway, I mean, to try to put it very simply into a soundbite type of thing, in a patient that has very mild cyclic vomiting syndrome, which are most of the patients, but the minority of the ones I see, because I usually see the
Right.
worst cases.
Right.
Probably the lifestyle, the CoQ is enough. Maybe B vitamins, maybe carnitine, which we didn't speak about, which is like another nutraceutical, another vitamin. And most of those patients get significantly better with those alone, and most of them will not want to proceed to medications like amitriptyline. Some do, but most don't. If you have a patient that's had vomiting episodes that last 2 weeks long and has an episode every month, that's a very severe case that, in my experience, you need to put medication on top of that. They're not going to get better just on vitamins and lifestyle.
Right.
And so I start everything at the same time.
Right.
Later, if they're in complete good control, everything, we can talk about trying to wean things off a little bit. But we want to get them under control as much as possible.
Right. I see. That's great. I have one more question. What about probiotics? What do you think about probiotics?
A lot of my patients are on probiotics. I usually leave that up to the GI specialist. Almost all of my patients do have a GI specialist because they have a lot of gastrointestinal disease. But probiotics are very helpful in a large number of them, and I certainly something that I recommend and I encourage.
How is probiotics different from a B12 or CoQ?
Well, probiotics are bacteria. When you're giving large amounts of what we call the good bacteria, it's displacing the bad bacteria that cause more symptoms. Some of the bacteria in there causes more gas and pain and things, and so the good bacteria supposedly displaces them.
Well, thank you so much. I appreciate your time, Dr. Bowles. Thank you.